RFK Jr. has another big announcement. New dietary guidelines coming in December. Now, we keep saying that the old guidelines are the problem, but there's one big thing that he's missing that most experts already know. Most people don't follow the current dietary guidelines. And the current guidelines already say what any reasonable nutrition scientist would tell you. Eat more fruits and vegetables, more beans, more whole grains, more seafood, more nuts, eat less added sugars, less sodium, less saturated fats. And if anyone tries to tell you something about the food pyramid, they're over a decade out of date. The food pyramid was replaced by the My Plate Food Guide in June of 2011. Now, a 2024 systematic review found that people who do eat more closely in line with the current dietary guidelines have lower mortality rates. The current advice is good advice. It's rooted in good evidence, but it can be hard to follow in practice. That's where Kennedy is headed for a wake-up call. It's already very obvious to anyone who actually has had training in public health. The hard part does not rest in telling people what's healthy or what they should do. The hard part is building a world where people can actually afford to be healthy and have the time and the wherewithal to do the things that they already know they should. Like, it doesn't matter how many times you tell someone that they should eat more avocados and salmon and blueberries and cook more meals at home with fresh whole ingredients if they don't live within walking distance of a grocery store that sells any of those things, and they don't have a car, and they're busy around the clock from working 2 jobs and raising children while being stressed beyond belief. Updating the dietary guidelines is not going to help that person. Roughly 36 million Americans live in poverty, which is around 1 in 10. Almost 14 million children live in households that sometimes struggle to put food on the table, which is absurd in a country with as much wealth and resources as we have here in the United States. So no, the problem isn't that the guidelines need to tell people to eat more beef tallow or French fries fried in beef tallow, whatever Kennedy is going to say in the December report. I don't know, we can talk about that then. But if the government really wants to make a difference, they should stop pretending that this is some obscure scientific debate. They need to start treating it like an economic and structural problem that makes it incredibly hard in practice for millions of families to take care of their health in the ways that they wish they could, in the ways they know they should, but wish they could. It would be nice if we had a Secretary of Health that understood this, rather than us having to sit here and watch him learn on the job.